Welcome back to Morning Joe. Beautiful pictures of Manhattan. Here with us now, Republican representative from Louisiana, member of the House Ways and Means Committee, Congressman and Dr. Charles Boustany. How are you, sir?
I'm doing great. Great to be with you, Joe.
Thanks. So this is actually Willie. Joe will be jumping in just a second. Want to ask you about your approach to health care. We've heard the president's approach. How do you assess his plan, and what would you do differently?
Well, first of all, as a clinician, a doctor who has had over 20 years of experience dealing with patients, critically ill patients, I should say, with heart disease and cancer, everything has to focus on the doctor-patient relationship, because that's where quality and cost really intersect. And so as we craft a Republican response, we're going to focus on strengthening the doctor-patient relationship, creating a wide range of choices in the insurance markets for families who are struggling with the cost of insurance, for small business owners who are struggling with the cost of insurance. And I believe that's the way you approach this in general terms.
Dr. Mark Halpern here. Two questions. First, I've got this sore elbow here. I'm wondering if you've... Just kidding. No. Look, you all have a much more free market approach than the president does to trying to solve this problem. But obviously, as you know, a lot of people in the business community would like a solution. Where are the areas where you agree with the president? Is it possible the president could propose a bill, Democrats in Congress could propose a bill that you would be for, or are you just trying to offer an intellectual alternative?
Well, I'll tell you, Republicans have a lot of ideas on health care, and I think there's area for broad agreement on a number of issues.
What are they? Where do you agree with the president on a solution?
Sure, certainly on emphasis on prevention and early screening, early detection, creating choices in the insurance markets, creating real competition, bringing forward transparency and using information technology in a responsible way so that patients and families know what they're getting. I think those are things that we can all broadly agree upon. But I'll tell you where we disagree. We disagree with a government bureaucratic option that's going to interpose bureaucrats between the doctor and the patient. That's a red line we don't want to cross.
Joe Scarborough.
Hey, Joe.
Do you think, Congressman Doctor, do you think that it's important for Americans to all have health insurance? We always hear about 47 million Americans who are currently uninsured. How critical is that gap to close?
Well, first of all, let me say, as Republicans, we believe we can cover all Americans with a good health care policy. We need to create policies targeted to those groups. That 47 million folks is not just one big group of people without insurance. We need to break it down into its segments. Some are young folks who actually are making pretty good money, who could actually afford insurance if we can create affordable products. Others may need some assistance. The point is, we have to break it down. A young, healthy individual male, age 27, making $75,000 a year is different from a single female with 2 children who's scraping just above minimum wage. So I think you have to break it down and then target those solutions.
All right, Congressman Boustany, thanks so much. It's a critical question. We wish you the best of luck in Washington working through this. Thanks for being with us.
Glad to be with you.
All right, Mika.
All right, Will,
thank you so much.
Here with us now, the Secretary of the Department of Health and Human Services, Kathleen Sebelius. Madam Secretary, thank you so much for joining us.
Good morning, Mika.